Welcome to the Pulse of Healthcare. This is Dr. John McCormick. I'm here with Peter. We're going to pick up on our continuing discussion about healthcare and price limits. Last time we talked a little bit about administrative burden, the fact that providers were paid for outcomes and not paid for outcomes, but paid for activity. And I think that was a big disconnect. And then we talked a little bit about, hospitals and hospital administration and some of the ways that drives up the administrative cost of care. So we want to kind of pick that up today, talking about some of the other reasons that healthcare costs so much.
I'm looking forward to this discussion because I've recently went to the doctors, and as I walked in, I saw 6 admin people at the front desk and asked them, what insurance do you take? And they said 50 or more. Are they standard? No, there's no standardization of the forms. So
Right.
the challenge that they have is, how do I get my money?
And I think we talked about that last time, that even sometimes the same procedure, when you're bundling different things together, different CPT codes, not every company takes the same bundle. So you might bundle it one way for United and a different way for Cigna, but then it's a whole different way for Aetna. And if you don't do it the right way for that company, then your bill comes back and you have to do it again and again and again. And you got to think every time somebody transacts that paper, it costs that provider or facility additional money, which means at the end of the day, they're collecting less. So in order to offset what they do, they raise cost. I mean, it seems like pretty simple, maybe some standardization would be in order, you would think, since Medicare does have standardized rates and standardized CPT codes and things you can and cannot bundle. Those rules are all known. Why is not every commercial carrier mirroring that same deal? And so you have to go back to what I said in our last episode and say, I think it's convoluted and complicated by design.
Well, and as a layman that has been using the medical care and going through it with a number of different people, the more I use it, the more I got confused as to what was going to be paid for, what was a covered expense, and why some things were rejected and other things were kicked back.
And I wish to say here's your answer. Unfortunately, you can't. There is no here's your answer. It's, well, it depends. We'd have to look at the plan document, or we'd have to look at the agreement between that plan and the provider, which you don't get to see, by the way, because that's double top secret. So God forbid you actually see that. Last week, with a lot of more hullabaloo, of course, President Trump signed a new executive order to reinforce price transparency. And I read that, and I actually read the order, and I kind of went, yeah, okay, we already have a law for price transparency. So this is just basically saying, okay, hospitals and facilities, we really, really, really mean it, instead of we really, really mean it.
Yeah.
You really, really, really will be transparent, or else, okay. I hope it works. I hope it maybe gets better than the 30% compliance we have right now, because right now it's pretty dismal. And then you get a lot of that. Yeah, whatever. So let's dive into just a few more topics. So let's talk about lack of price limits. What does that even mean? Lack of price limits.
That means they can go on for 7 figures if they want to, whatever they want to throw into the bill.
I mean, that's kind of crazy, right?
Yep.
So if you are buying a good or service in any other industry, you would know what the cost is, right?
Yes.
Or you would at least know the range of cost, depending on where you're engaging in that service. And I'm going to just throw hotels out there because they do have a range of service, right? So if I was going to get a room for a hotel, I could shop hotels in a specific geographic region and select at least one that was in my price range. right?
Yep.
Well, that's what price transparency is supposed to be, and price limits, right? There should be some limits on the price of services. But as we all know, there are no limits in the charge masters of these facilities for hospitals because there is no rule. There is no, the most you can charge for this or that surgery is X amount of dollars. At least then we'd know what the top end of the range ought to be. All right. We can consider the bottom end of the range is probably Medicaid, which pays slightly less than Medicare. All right. Which my personal feeling should be the standard, some kind of Medicare, maybe Medicare plus a little bit, but not plus Medicare times 400% or 1,000%, or in some cases 5,000%. When we look at the difference between, the recent article about pharmaceuticals where had the government paid cash, they would have paid $10 for a prescription, but because they ran it through their Medicaid contract or Medicare contract, they were paying, $1,000 for what you and I could have bought for cash for 10. So that's part of the, fraud, waste, and abuse that's built into the system. But it's also part of the fact that we really don't have established price limits for care. At least if we had that, we could say, hey, they're at the top end of the price. That's the 5-star Hilton that has everything, and I just want to buy that. But really, what I want to really pay is the Motel 6 price. Just keep the light on and keep me from getting an infection.
Doctor, I have learned to at least ask up front, what's the cash price? I have never heard such hemming and hawing and guarding of what it could be by saying, we think it's going to be X, but that doesn't include the drugs, just the tests that are done. When you're talking at the front desk and you're asking, they can't give you a price.
It's sad that your vet can give you a price and your doctor can't.
Yeah.
I can sign up for a vet health plan at my very expensive vet if I want to use them here where I live, and it's $70 a month. Now, is it worth $70 a month? Yeah, I don't know. That's debatable. If it's convenient, if I'm paying for that convenience and I want to be able to take my dog in as often as I need to, and they're going to give me all free shots and things like that, then maybe that's worth $70 a month, right?
Right.
But they give me a whole list of things that includes. Now, if I don't buy their plan, if I just want to take my dog in and I go, well, I need to get them checked for heartworms and I need to get their rabies shot, and they hurt their leg. Can you X-ray that for me? I mean, the girl at the front desk can say, well, your appointment's, $65 and your heartworm test is $100 and your rabies shot's $50 and we can do a flat screen X-ray and that's going to be another $80. And if you want to buy 6 months worth of heartworm medication, that's $320. I know all that standing at the counter talking to the frontline service person.
Exactly.
Try that at a physician's office and you get exactly what you said. That deer in the headlight. I don't know. Why not? It shouldn't be that complicated. And part of it is that there's not any clear pricing, which is what this No Surprise Act and transparent pricing is supposed to alleviate. And we're just not seeing it. I mean, let's face it, we're just not seeing it.
The other place that I've run into lack of transparency is at the drugstore. Going to get a prescription and finding out at one store and this is honest to God truth, it was $34 at one store and over $300 across the street.
I know, and one of our one of our evil PBMs that we do business with. No, they're not evil. They're actually great. One of the PBMs we do business with has that tool. You can literally put in your prescription, put in your zip code, and it will tell you a different price to pick that up depending on what pharmacy you go to. Okay, I'm not shopping for steak, I'm not going to a restaurant where one's a, white tablecloth restaurant and the other one's the buffet. I mean, it's the same drug everywhere.
If and this is great. I didn't know that we had that capability with that vendor, but they can identify the price at all these different locations. Why can't the pharmaceutical companies themselves or the Walgreens or CVS identify and standardize their price instead of
Well, we talked about that, right? So we know that Optum, which owns CVS, which is part of one of the major carriers, has zero incentive to reduce their rates or even match rates anywhere else, because I'm getting paid on every side of the equation, which means I have no incentive to reduce your healthcare premium or save you money. I'm getting paid your premium. I'm getting paid sometimes from your doctor who I own. I'm getting paid for the medicine that they prescribe to you. What's my incentive? My loyalty, number one loyalty, is to my shareholders and to Wall Street. And that's why my company's worth billions and billions and billions of dollars. Healthcare companies have outperformed almost every other company in the stock market. That's great from a capitalism standpoint and horrible from a human being standpoint. And what I would say is, are we really working in this country to take care of people? By providing affordable, robust care at a fair price. At a fair price. I'm not saying a low price, a fair price.
well, I think it's pretty obvious that we take care of shareholders a lot more than we take care of patients.
Yeah, and I think that's true too. In our last episode, we talked about difference in specialties and getting paid more. And I said, I think somebody that's working on my brain certainly has a unique set of skills that should be paid for that. But there's also a pretty wide disparity in different kinds of specialists. And if you don't understand that, if we go back historically, there were not a bunch of specialized, super specialized doctors. You had, your generalist and your primary care, and then you had surgeons, and then you had very few, like cardiosurgeons and brain surgeons, that were very specialized. And now you have all these little subspecialists, that carve out different things, even to the point of anesthesiologists. I mean, granted, an anesthesiologist is hugely specialized, very important, because if they get it wrong, you die. So it's important that they get it right, and we want that. But one, they don't belong to any networks. And so you always end up with this weird kind of out of network scenario when you're dealing with anesthesiologists, and how do they get paid? And of course, the pressure from the plans is always trying to reduce their payment. They're trying to increase their payment, and who's caught in the middle? The patient.
The one who pays.
Right, the one who ends up paying. Right. So one of the things that we need to understand is that where Medicare sets the kind of the national rate, and that's based on actuarial studies. That's not like, some people sitting in a back room that just kind of make up numbers and say this is worth this and that's worth that. They're actually looking at the actual cost to deliver care across the nation. It's adjusted by county. Some counties pay more than other counties for the same service because of the economics of the county. Mm-hmm. All right. So it's not like all those things are not considered and factored. If you were doing a procedure in Houston, you might get paid one rate. And if you were doing it in San Antonio, it might be a lesser rate because of the overall economics of the community and what it costs to deliver care in that area. So it's not like Medicare doesn't have a very robust calculation for that. Now, you can certainly argue that it's not enough, but I think there's other mechanisms to bring that up to what I would consider fair, as opposed to punishing the working class to make up the difference.
Well, the challenge is gonna be how do you get the industry to follow those pricing guidelines? Since they have ignored it as badly as they have in the past. I agree with you that should be the case, but it never should have gotten off track the way it is now anyway.
Absolutely. You know, and I know we've harped on this over several different podcasts about basically healthcare pricing being a mystery, right? I mean, that's what we've
Yep,
been talking about
absolutely.
today. Why is it a mystery? It should be transparent. What's the downside of transparency?
Hidden.
Well, the downside of transparency is, let's say you have 10 hospitals in a 10-mile radius, and people like us that are savvy and are working with our members and trying to find them great care at a fair rate, we're going to hospital number 8 to get this surgery because we know at that place we can get it for $5,000, right? Where hospital number 1 in that same circumference is charging $20,000. Now, let's say we have price transparency and all hospitals look around at each other and go, I'm going to raise my rates to $10,000 because they can get it over there. So is it going to drive the price up or down? You would hope in your brain, you'd think, oh, they'll drive down because they want to compete for the business. But they all know each other. So it could actually work against us instead of for us.
Yeah,
That's kind of scary, right?
Yeah, I hadn't considered that aspect
And
of
that's
it, but
that's why you got to know what. That's why I think it's imperative that we set a high end expectation. This is the fair market rate. All right, to do this, that you shall not exceed. I don't care what hospital you are. This might be Medicare down here, but this is the highest you can charge, and there has to be some reasonableness in there. If we're going to be transparent, I think we got to have guardrails. If you take off the guardrails, then really what you're doing is creating an unintentional price monopoly. You know, and I just don't think that's something that the big smart heads in the government have considered. They've only considered the other side of it, like, well, if everybody knows, then we can all be smart consumers and shop. Well, if everybody knows, and we already know that the hospitals are all in cahoots with each other along with the major insurance plans, then why won't they just all raise their rates to match the same? We're transparent. We all charge the same amount, which is 10 times more than it ought to be.
If we look at past experience, we know they're just going to raise their rates.
Stop. Exactly. I shouldn't have said that out loud. Now it's out on the public airways. One of these hospital CEOs is going to listen and say, yeah. You know, there was actually, I hate to say, there's actually a lawsuit against one of the major hospital systems where they got sued for their charges being egregious. And it turns out that they had actually hired a consultant to do exactly that, to go around and find out what the highest price was for all of their CPT codes in their surrounding areas. And then they just raised their prices to match it all. So they matched the worst price for every procedure from all the facilities around them. So you don't think it can happen? They're already hiring people to make it happen. That is sad.
That is very sad.
That is sad. Well, that's going to wrap up this episode of the Pulse of Healthcare on that positive note. My goodness. We're going to come back soon. We're going to wrap up this series in the next time. When we come back, we're going to talk about the high cost of prescription medications. I touched on that just a little bit. My favorite punching bag, which is private equity and Wall Street. We'll touch on that just a little bit, and that should wrap up this series completely.
I hope everybody is enjoying and learning as we go along, as I am, as we have these podcasts as well.
All right. Take care.